Students, welcome to the next session of the general medicine discussions. So today, in succession of the topics what I have been discussing in the previous videos, that is about the thyroid disorders, the thyroid gland anatomy I have discussed in the previous video, the types of hypothyroidisms, that is the hypothyroidism and the hyperthyroidisms. In the previous video I have discussed about the as to what are the basic types of hypothyroidisms, that is the primary hypothyroidism, the secondary hypothyroidism, and the tertiary hypothyroidism. So these all topics I have covered in the previous video. So today the next topic of my discussion will be about the clinical features of hypothyroidism. So the clinical features of hypothyroidism can be just related to, can be studied under basically 5 headings. That is, first will be the general features, next is the reproductive features what are seen, next the gastrointestinal symptoms, next moving on to the nervous systems and the cardiovascular symptoms. So students out there, one thing more I would like to tell you, that this hypothyroidism, it is mostly more commonly seen in the females. More commonly it is found in females, and the clinical features can be broadly summarized and discussed under 2 broad headings, that is the symptoms and signs. So whenever a disease is manifested, it is going to have certain kinds of signs and symptoms as well. So just there is a peculiar and a minute difference between signs and symptoms. Signs are the things what the physician or the surgeon or the person who is examining the patient observes. So signs are those particular things what the physician or the surgeon or the practitioner is going to observe within, and it is going, and the physician, what the physician is going to look for in the patient. The person who is examining a particular patient, signs are those things what he is going to observe, whereas symptoms are those clinical features what the patient comes and tells to the doctor or the physician. So there is a minute and a slight difference between signs and symptoms. Symptoms are the things what are told by the patient himself when he visits the practitioner or the physician, and signs are those things what the practitioner or the doctor is going to find in the patient by performing certain kinds of actions, or performing certain kinds of motions in the patient. He is going to find out, look for the signs. So signs and symptoms, these they are usually used hand in hand, but there is a slight difference between these two terms. All right, so now beginning with the topic of today, that is the clinical features of hypothyroidism. So particularly in the previous video already I have told you that hypothyroidism, it's more commonly manifested in the females. So beginning with the most common symptoms for the hypothyroidism, first category we are going to look for the general symptoms. So what are the general symptoms? So now talking of the general symptoms, if a patient is suffering from hypothyroidism, he is going to certainly complain of certain kind of weakness or tiredness. So the patient, when he comes to the OPD, he just firstly he'll tell the doctor or the physician that he is feeling some kind of a tiredness or weakness, sluggishness, and this can also be, sometimes he may say that he always feels somewhat lethargic, or he's feeling very much tired, and weakness he's feeling, general weakness. So the general symptoms what the patient can tell, it includes that he can feel weakness, there is tiredness, that is the patient can be having there can be lethargic. Next very important striking feature is that the patients who are suffering from hypothyroidism, they are going to have certain they are going to have cold intolerance. So the patients are unable to tolerate cold. Mostly such patients are going to have they prefer mostly hot things. So they have a more liking and inclination towards, preference towards the hot things, and they are unable to tolerate cold. Moving on to the next category, next important thing, that the next important symptom what the patients complain of, that they'll be having some kind of a dry and a coarse skin. So dry and a coarse skin is another general symptom. Moving on, the patient may manifest pallor, that is the mucosa may become somewhat yellowishness, the pallor can be seen. hair loss. In certain patients, in certain females, due to hypothyroidism, there can occur hair loss. And the most clinical important striking feature of hypothyroidism, it is that the patient is going to somewhat have a puffy face. That is a puffy face, hands and feet. So the patients who are suffering from hypothyroidism, it's a very common finding that they are going to have somewhat a rounded, puffy hands, face and feet. So next very important feature, the very striking feature, a very distinguishing feature for hypothyroidism is myxedema. So actually, what is myxedema? So students out there, I would like to clarify this, that myxedema is a kind of a medical condition where in the tissues there occurs deposition of hydrophilic mucopolysaccharides. So hydrophilic mucopolysaccharides are going to get deposited into the tissues, and since these hydrophilic mucopolysaccharides are getting deposited into the tissues, this leads to a generalized edema or a swelling which is manifested in the patients. Generalized edema or swelling, it is found, and such an edema, it is a non-pitting edema. So there are two kinds of edemas basically. One is the pitting edema, the other is the non-pitting edema. So in myxedema, due to deposition of the hydrophilic mucopolysaccharides into the tissues, there is going to be a non-pitting edema is manifested. So non-pitting edema, that is myxedema, is a very striking and distinguishing feature of hypothyroidism patients. Very important, next important point, what is to be considered over here, it is that the patients who are suffering from hypothyroidism, they complain of that their weight, they are putting up on weight, they are going to gain weight in spite of having a decreased appetite. So they are going to consume less, but still their weight is going to definitely increase. So they are going to put on weight in spite of having a decreased appetite. Moving on, the next important clinical feature, it is the hypothermia. So the patients are always having a cold and a clammy skin. Moving on, the patients can also they can also manifest with goiter, and hoarseness of voice can occur. So this were all about the general features, the general clinical features, the general symptoms what the patients may experience. Moving on to the next important category, that is the reproductive clinical features. So the clinical features what are going to affect the reproductive system, the reproductive clinical features include menorrhagia. So that is mostly this hypothyroidism is most commonly seen in the females. So what it is going to happen is, in the females, menorrhagia can occur. That is, there increase in the menstrual blood flow. So the menstrual blood flow is increased during hypothyroidism. In some patients, in some females, there can also occur amenorrhea. That is, complete absence of menses can also occur. That is amenorrhea. Next very important thing, if it is the hypothyroidism is an uncontrolled way, if it is going to have if this hypothyroidism it is not controlled, it can also lead to infertility. In certain females, it may manifest in the form of infertility. And the last, galactorrhea can also be seen in certain females. Moving on to the gastrointestinal system symptoms, the clinical features what are found in hypothyroidism include, there can occur constipation and large tongue. So the patients who are suffering from hypothyroidism, they may complain of constipation, and they can manifest with a large tongue. On examining the tongue, the patient's tongue may be enlarged. Moving on to the next category, that is the nervous system manifestations. So in the system, the patients who are suffering from hypothyroidism, they may manifest with certain nervous system ailments or disorders, such as they can have a poor memory, they may find difficulty in having concentration, that is, they can have a poor concentration. The carpal tunnel syndrome. So carpal tunnel syndrome, students, I would like to mention as to what is the carpal tunnel syndrome. So in carpal tunnel syndrome, there occurs, it is mostly manifested in the wrist. So in the wrist, what it is going to happen is, when the medial nerve is going to pass through the wrist, it is getting compressed. So in carpal tunnel syndrome, the medial nerve which is passing through the wrist, it gets compressed and the patient may complain of pain, numbness and tingling sensation. So this pain, numbness and tingling sensation in the wrist due to the compression of the medial nerve, it is called as the carpal tunnel syndrome. It is the carpal tunnel syndrome which is very commonly found in patients of hypothyroidism. Moving on to the next very important clinical sign, what the physicians or the practitioners, doctors look for, that there is a delayed relaxation of deep tendon reflexes. So there can occur a delayed relaxation of deep tendon reflexes. Deep tendon reflexes, or in other words, there can be a delayed relaxation of an ankle's reflex. So in the patients of hypothyroidism, this delayed relaxation of deep tendon reflexes or delayed relaxation of ankle's reflex, that is the Boltzmann sign. This is a very peculiar and a distinguishing finding what is seen in the patients of hypothyroidism. Moving on to the last but not the least, the cardiovascular system. The cardiovascular system, what the clinical features, what can be seen here, comprises of all the signs. So the physicians or the surgeons or the doctors who are going to examine the patients of hypothyroidism, they may find that the patients are going to manifest with bradycardia, that they can have a decreased heart rate. Moving on, they can also manifest with hypertension. Thus, such patients can also manifest, in some cases that is also found, that there can be an ischemic heart disease. So there is a decreased blood supply to the heart, which can be manifested in the form of an ischemic heart disease. And lastly, in some patients, the pericardial effusion is also seen. So students out there, this was all about talking of the clinical features of hypothyroidism. Moving on, this is how I have discussed about the hypothyroidism, the clinical features. In the upcoming videos, I'll be talking of the surgeries of the thyroid gland. So students, do stay connected. Looking for the surgeries of the thyroid, I have made it much simpler as to how we can very easily remember about the different types of surgeries what are done in thyroidism. In thyroid surgeries, I'll be talking of in the upcoming video. Students, if you do like my video, don't forget to subscribe my channel and do press the bell icon so that you can be further updated for the upcoming videos. Thank you for watching.